Today, we're going to focus on bilingual education and second language acquisition, two foundational areas for counseling culturally and linguistically diverse students. So, in whatever role you're going to be playing, it's crucial that we grasp not only the educational structures shaping English language learners' experiences, but also the linguistic, psychological, and systemic implications that impact their trajectories. So, we're going to ground our discussion in the work of Rhodes, Oka, and Ortiz, which provides a great theoretical foundation. So here's what we'll be covering. First, we'll explore why this knowledge is essential. Then we'll examine how English learners are faring nationally in terms of academic attainment, and we're going to look at various types of bilingual and ESL programs, which students may have experienced or may be experiencing, and the research evidence on their effectiveness. So from there, we'll shift into second language acquisition theory, stages, timelines, and key language constructs. And finally, we'll conclude with some common linguistic characteristics in English learners and how we distinguish between difference and disorder. So throughout, I'll offer counselor-specific takeaways and ethical considerations. So I think there's four key reasons why every graduate counseling student, whether entering schools, clinics, or communities, must understand bilingual education and second language acquisition. First, we want to dismantle the myths. Many practitioners still believe that bilingual education delays English acquisition or that full English immersion is superior, and these are unproven and harmful ideas. So our role is may include educating families and colleagues when these myths appear in our offices and in our schools. Second, our LEP students are disproportionately referred for special education. So often not because of a true disability, but because of language related behaviors that are developmentally appropriate for second language learners. So as counselors, I want you to be the first person to raise the question, is this truly a disorder or a mismatch between language development and instruction? Third, under IDEA 1997 and its updates, we are legally and ethically bound to ensure that students are not misidentified due to a lack of opportunity or language proficiency. So counseling referrals, academic concerns, even behavioral issues must be assessed in context. Fourth, assessments must be conducted in the student's dominant language unless clearly not feasible. So this includes mental health screenings, social emotional assessments, and family intake. So we cannot assume that conversational English fluency equals academic or clinical fluency. So let's look at the data. And LEP is limited English proficient. So only 16% of LEP students scored above the state norm on English reading comprehension, and only 30% did so on Spanish reading. This is from the article. So the dropout rate for students from non-English homes is 24.2%, far higher than even the rate for students with identified learning disabilities. So as graduate students, ask yourself, what does this tell us about equity? What supports academic, social, emotional, linguistic are missing. These numbers are not reflections of student capacity, but of systemic failure. So again, your job is to ask the right questions before making assumptions. Has the student had access to a qualified bilingual teacher? Did the program foster their home language? Are they being unfairly pathologized? So now consider this. In some districts, there's only one certified bilingual teacher per 1,000 students. So on average, it's 1 per 76 for bilingual teachers and 1 per 30 for ESL teachers. And most states don't require full certification. So for counselors, this matters. If a student's academic or emotional struggles are arising in a school context with insufficient linguistic support, those struggles are likely contextual, not intrinsic. So before making referrals or diagnosis, investigate the student's educational history, advocate for culturally and linguistically responsive services, and document when services are lacking. There are three main types of bilingual programs you may encounter in your counseling work. These Distinctions matter because they dramatically shape a student's linguistic development and academic identity. So, transitional early exit programs, these last only 2 to 4 years. They begin with some instruction in the student's native language but shift quickly to English. These programs are subtractive in that they aim to replace the native language rather than maintain it. They're the most common, but also the least supportive for long-term achievement. Then there's the maintenance or late exit programs. These run 4 to 6 years and use models like 90-10 or 50-50 language splits. These programs value the student's first language and are considered additive. So language arts are taught in both languages throughout. These students tend to do better academically and emotionally and often feel more secure in their identity. There's the two-way or dual language program. These are the gold standard. They include both LEP, so limited English proficiency, and native English speaking students and aim for full bilingualism and biliteracy. So they typically last 4 to 6 years and use alternating language models. So students in these programs often achieve at or above national norms and show strong cross-cultural empathy. So as counselors, understand what program the student experienced. If the program cut off their home language early or devalued it, this may contribute to identity distress or academic disengagement or feelings of cultural erasure. ESL models differ sharply from bilingual ones, both in content and purpose. So there's the content-based ESL. Here, students are taught academic content in English using simplified language, gestures, and visual cues. It may make up their entire day. The goal is to teach subject matter while the student learns English. This model does not preserve the native language. There's pull-out ESL, where students are removed from the mainstream classroom for English instruction, often for less than half the day. So the focus is not content learning, but English language skills. It's widely used, but not very effective long-term. The danger, especially with pull-out programs, um, this is so obvious, isn't it? Is that students fall behind in both English and content knowledge. So for counselors, remember these students often appear behind, but the cause may be inadequate instructional time or program design, not a disability. So let's look at what the research tells us. Danoff, this is an older study, it found no positive effects, um, but it's methodologically flawed, so it's often cited out of context. The Willig and Green both conducted meta-analysis and found that students in bilingual programs outperformed those in English-only settings, especially in reading and math. Ramirez found comparable short-term results between immersion and transitional models, but superior long-term outcomes for maintenance programs. Thomas and Collier, these are the most robust studies to date. They found that students in dual language and maintenance programs achieve the highest levels by 12th grade. So students in pull-out ESL programs score the lowest and are most likely to drop out. So as counseling professionals, use this data to guide conversations with families, advocate for better programming, and inform how you interpret academic records. So if a student has been in a weak program model, we want to be cautious not to attribute, I can't speak today, sorry, not to attribute failure to internal traits. So this slide asks the question, is the student's academic struggle due to a true disability or a consequence of poor instruction and language mismatch? So counselors, this is where you must tread carefully. So under IDEA, before a student is referred for special education, we must rule out lack of opportunity and language barriers. So when you see a referral, ask what type of language program did they attend? How long were they in it? Was their native language supported? Was instruction aligned to their proficiency level? These aren't really optional questions. They're required to ensure ethical, non-discriminatory assessment and to avoid misidentification. Students acquiring English as a second language move through 4 distinct developmental stages, which are often misunderstood and misinterpreted in schools. So if you're counseling or assessing an English learner, knowing these stages is critical. So pre-production, This is often called the silent period. Students are listening and building comprehension, but are not yet speaking. So you might get yes, no, or one word answers or just gestures. This isn't defiance, withdrawal, or delay. It's developmentally normal. Then there's early production, where students begin to use short phrases, 1 to 3 words. They may rely on memorized routines like I don't know or what's this. Don't mistake these rehearsed responses for real fluency. Then there's speech emergence, when students can produce full sentences and show vocabulary growth, but grammar may be inconsistent, so they still need scaffolding and visual support. Intermediate fluency is when students engage in conversations that may sound fluent, but academic language is still developing. So they'll make fewer errors, but we don't want to overestimate their competence, especially with abstract or emotional language. So as counselors, avoid jumping to conclusions based on conversational fluency. A student may appear fluent in a check-in or small talk, but struggle deeply with classroom content, expressive language, or emotional regulation in English. So this distribution is one of the most critical concepts in language acquisition and one of the most commonly misunderstood. So BICS, this is the social language, playground talk, greetings, casual conversations. Students typically develop BICS within 2 to 3 years, and many educators mistakenly think a student is fluent based on this, but BICS is not enough for school success. Then we've got CALP. This is the formal academic language used in textbooks, essays, directions, and assessments, and it takes 5 to 7 years to develop, and even longer if the student hasn't had strong schooling in their first language. So, as school counselors, this is where misreferrals happen. A student may seem fluent because they can chat in the hallway, but if they haven't developed CALP, they may be struggling silently with reading comprehension, writing, or even understanding questions in therapy. So, always ask yourself, are they struggling because of limited CALP? And for mental health counselors and MFT students, understanding second language acquisition is essential when working with immigrant or multilingual families. So, a child's silence, code switching, or difficulty articulating feelings may reflect developmental language norms, not trauma or oppositional behavior. And misreading these signs can lead to misdiagnosis, rupture therapeutic rapport, and undermine culturally responsive care. So, always assess, language access, educational history, and cultural narratives to shape emotional expression, and how those shape emotional expression within the family system. Okay, English language learners exhibit normal expected behaviors that are often misread as signs of language delay disorder or defiance. So let's walk through them. Interference. So when patterns from the first language carry over, we're talking about interference. So, for example, a Spanish speaking student may say more big instead of bigger. That's not incorrect. It's cross linguistic influence. Okay, interlanguage. That's a hybrid form of language students use while acquiring English. It evolves over time. So, you might hear unusual word order or verb forms. Silent period. Again, this is typical. Students may say little or nothing for months while processing. This is not shyness or selective mutism. Code switching. Students may switch between languages mid-sentence. This is not confusion. It's actually a high-level linguistic skill. Language loss. So in English-only settings, students may lose proficiency in their native language, especially if they aren't using it at home or school. So this can lead to identity loss, family disconnect, and even grief. Language differences. These are cultural and structural, like adjective noun order or pluralization. It should not be pathologized. And so, as counselors, you may be the first to notice these patterns in speech or even writing. So, knowing what is typical helps prevent unnecessary referrals and helps build trust. This is part of your exit ticket. So, let's end with 4 essential takeaways that you should carry into your counseling careers. Students in dual language and maintenance programs do better long term than those in transitional or ESL only programs. So remember to ask about program history. CALP takes 5 to 7 years. BICS develops faster. Always distinguish between the two when interpreting performance or planning support. If you're evaluating or interpreting evaluations, ensure students are tested in their dominant language whenever possible, and you want to document how language proficiency may impact results. You want to basically ask the right questions. So instead of jumping to diagnosis, ask, did the student have access to quality instruction in their home language? Have they had enough time to acquire CALP in English? Are we seeing a delay, a difference, or mismatch between instruction and need? So your advocacy matters. By understanding these dynamics, you are not only protecting students from mislabeling, you're promoting equity, affirming identity, and ensuring that linguistically diverse students receive the support they deserve.